Welcome to Your Health. I'm your host, Rhonda Alfred. Joining us on this episode is Dr. Ugo Ezema, pulmonologist and critical care specialist at Terrebonne General Health System. He will talk to us about Terrebonne General being the only facility in the region to now offer robotic bronchoscopy services. Welcome to the show, Dr. Ugo.
Thank you. Thank you so much for having me.
Well, I'm so excited that you're joining us today. We have a lot of good things to talk about.
Yes, ma'am. Yeah.
All right. Well, let's get started with you telling us about yourself and your role at Terrebonne General.
Well, like you said in the intro, I'm Dr. Ezema, Dr. Ugo Ezema. I'm a lung and ICU specialist here at Terrebonne General. I focus primarily on lung and pulmonary diseases, asthma, COPD. Helping with the diagnosis of lung cancer is one of our main things that we do here at Terrebonne, and of course working in the ICU helping our really sick patients.
We have some new technology on board and I know you're excited about it. What is robotic bronchoscopy and how does it differ from traditional bronchoscopy?
First, bronchoscopy is a scope that we use to go into the lungs and navigate the airways and lungs to help and diagnose certain disease processes, especially those that affect the lungs. The robotic bronchoscopy is an advanced technology that's robot assisted. So a robot assists you in doing the bronchoscopy itself. Traditional bronchoscopy is manually manipulated to get it to the individual airways, whereas with a robot, it's like you're playing, it's like a video game that you're using to navigate using the up-to-date CT scan to navigate to the airway and find exactly where you're trying to go into the lungs.
Okay, can you explain the technology behind the robotic bronchoscopy and how it enables more precision and control during the procedure?
Yeah, that's a great question. The technology is basically not that different from what I was hinting at. It's a way to essentially make the movement through the lungs much more fine-tuned and refined. It's the catheter, there's a catheter that comes with the robot that has a camera attached to it. And when that goes in, you advance using the robot's controls and you advance into the airways. The real benefit of it is that it allows you to have very fine movements and better control of the scope. The technology includes that the scope and the catheter has some microfibers that facilitate those fine movements through the airways.
Okay, and why did Terrebonne General think it was important to invest in this technology?
Terrebonne wants and has always been very progressive about being on the cutting edge of technology. And for us in the pulmonary department, we are focused, especially with our patients that have lung cancer, which is the biggest benefit of the robot at this time, is helping with diagnosing lung cancer and small lung lesions, assessing them, even the ones that are really far out in the lungs, finding them early and helping to treat them early. And that helps everyone. And Terrebonne, of course, like I said, being very mindful about, pushing the envelope and trying to improve the quality of lives of our patients, felt that having a device, an advanced technology such as this, would be beneficial for our patients and our patient population.
Yes. And what is the main advantage of using the robotics in this procedure?
There are a few things that come to mind. The most important ones are, like I said, early diagnosis of lung cancer. A few that are also important is because we're having very refined and precise movements, reduced complications from procedures, as well as patient comfort and satisfaction. So these things help and in the big picture and improving our patient outcomes and patient satisfaction and keeping our disease processes, catching them a lot earlier so that we're improving the quality of lives of our patients.
Can you tell me how it improves the outcomes?
The biggest thing is catching disease early. Catching disease early. Right now, like I said, the most important thing that we're attacking or we're focusing on is early diagnosis of lung cancer, especially here in South Louisiana. Lung cancer is the leading cause one of the leading causes of cancer mortality in the state. And so catching these diseases early at an earlier stage and getting our patients to the treatment and care that they need sooner. That is the biggest upside to having this technology.
Okay. And what types of conditions or procedures can be treated or performed with the bronchoscopy, robotic bronchoscopy?
Right now, lung cancer is the biggest one. But essentially, almost any lung disease at some point, if we need to go into the lungs to get samples for any sort of infection or inflammation or interstitial lung disease, so processes that affect the meat of the lung, and we need to get a sample, the robot allows us to go to exactly where we need to go and get these samples, again, minimizing the consequences and outcomes of the procedure, so minimizing the complications and getting us to a place where we're having really good answers that are helping us take care of our patients and minimizing the downsides to those procedures.
Well, that's totally amazing.
Yeah, absolutely.
So how can individuals schedule an appointment?
They can schedule an appointment several ways. I think the most common way is to send a referral through your primary care provider to the Terrebonne Pulmonary Clinic, and we'll be happy to see anyone and everyone if you have any questions about your lung health. Other ways is calling the clinic and seeing what we can facilitate to get you going.
Okay, well, thank you so much for all that you're doing. I mean, on the leading edge of technology here.
Absolutely, it's my pleasure.
For more information about robotic bronchoscopy at Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next week.